Good afternoon. The situation is still worrying in senior homes. We still need reinforcement. I'm asking Quebecers who can work full-time in residences to apply on the Je Contribue website. The great majority of hospitalization caused by coronavirus are currently happening in the Montreal region. This is why I'm announcing today that we're pushing back the reopening of non-essential businesses in the Montreal region to May 18. As for the elementary schools and child care services, we still have 2 weeks ahead of us. We will follow the situation very closely and take a data-driven decision. We maintain the calendar for construction sites and factories, as well as non-essential businesses outside the Montreal region, but I'm asking business owners and clients to follow physical distanciation rules. We must continue our efforts. I'm counting on you all. Thank you.
Hi, good afternoon. Premier Legault, you just said that it was a gymnastic for the reopening of schools, primary schools. So what do you say to school boards? For example, the Quebec English School Boards Association and other groups that want more flexibility or latitude when it comes to reopening school on the proposed dates?
But first, it will be the parents who will decide if they send or no their child to school, not the old school boards. The parents. The responsibility of the school boards and the people in charge of schools in the English community is to open schools when we say, yes, it's the date, it's the right time to open schools. Then the parents will decide if they send or no their children, not the old Anglophone school boards.
But they say they are not ready. They're not
first,
ready.
First, we're talking about May the 19th. Okay, so we still have 2 weeks in front of us. And we say we accept that it's not perfect. But they cannot decide that no school will be open for the Anglophones. They cannot do that.
But they are.
They won't.
Thank you. So now Philotier, Montreal Gazette.
Good day. Mr. Arruda, I was wondering if you could bring us up to date, and also for Mr. Legault, if you could bring us up to date on the situation in Montreal. It does not seem to be under control. You mentioned, sir, that in the rest of the province things seem to be under control, but it's less so in Montreal. And we also have Mme Drouin, who's the head of Montreal Health, saying on a l'impression qu'on n'a pas rempli toutes les conditions. So can you update us on what's happening in Montreal, and is it under control?
In fact, what is going on in Montreal is that we still have cases every day. It's clear that we're going to have even more with the testing we're going to do. So that is something. But what is making us thinking that we are still having, I would say, hospitalizations which are not getting up, but in a plateau. It's the same thing for intensive care. So because of this, we want to check what is going on, and those people who are hospitalized, are they coming from CHSLDs or they are coming from the community? And there is the specific, I would say, situation in Montreal North and Parc Extension, where there seems to be having cases over there. There's going to be a specific screening testing being done this week, and we will look at what is happening, because this is a stability, because we are not going down as we thought we would go. We prefer actually to delay, I would say, some deconfinement situations. So we're going to look at what's going to happen in the next days and take decisions based on that. So we are confirming the impression of Dr. Mylène Drouin, but we are working with her to looking exactly at more specific data from their communities.
I just want to say that we want to reopen stores in Montreal, but we know that if we reopen and when we'll reopen stores, we'll probably have more cases in our hospitals. So right now the situation is under control with the way it's managed, with the number of people that we have right now continuing to stay at home. But if we open a bit, we need to have a margin, and we don't see this margin today. So we have now 2 weeks to see the situation in the next days.
And as my second question for Mr. Arruda, can you explain to us again the surprise addition of cases and deaths on Friday? I believe you said it was a computer error, but is that the only explanation? Because it's a substantial number of people.
It is, but it was in a lab of one hospital who have a big number of cases, and with analyzing a lot of data, they changed the informatic system, and there was no programmation to send this information to the public health. In fact, the case have been managed from a clinical perspective. It means that they have been aware the clinicians were aware there was a case, but what was supposed to be said is to give the information to the public health. That's the public health who makes the data. So suddenly somebody looks and said that there is a problem. Those cases have not been are there, but they have not been declared to public health, and it's why we had this big surprise of 1,300 cases. But they were not all in the last week. They were from the beginning of April, even late March, cases that have been tested for that time and that have not been sent to the public health.
Thank you. Samuel Pouliot, CTV News.
Hi. Some businesses opened today outside the Greater Montreal. They are open with new safety precautions. Are these precautions going to have to remain in place for the foreseeable future?
Yeah. Yes.
And with the reopening, Dr. Arruda, you advised to wear a mask in public transport. Is it in the plans to distribute masks in the public? I know some cities in the world do it because some people find it hard to find masks.
But there is a lot of new production of masks everywhere, even here in Quebec. So we'll see. It's clear it becomes mandatory in certain transportations. We're probably working with municipalities who can especially afford and give some masks for the ones who don't have it because of, I would say, poverty or incapacity to do it themselves. But for most of the people, you can have, I would say, couvre-visage, or even you can do it by yourself, even with a foulard, a scarf. It could be another way to do it, but we will evaluate that, especially with municipalities, especially if it's become mandatory for transport.
Thank you. Question for Mr. Legault. The leader of the opposition says next week is too early for Montreal to reopen. Are you rushing things? Will you reconsider?
I just announced that we postpone the opening of retail 1 week. It's not because of Pierre Arcan, but he must be happy.
Thank you. And what about schools and
schools? We still have 2 weeks to look at the figures before taking a decision. So I'll take those 2 weeks before taking a decision.
Thank you. Enough for Minister McCann. Why are some CHSLD's residents who are being sent to COVID-19 units being charged extra fees? One family received a $400 bill after their father died.
Oh, I'm not aware of this, so I will look into that situation and give you an answer certainly on Wednesday.
Thank you very much. Alors, j'espère que j'ai oublié personne. C'est ce qui complète pour cette conférence de presse.
Merci.
À bientôt.
Merci, bonne semaine.
Merci.